Immunization is the administration of a weakened form of a disease that allows the body's immune system to develop adaptive immunity to that disease. Once the immunization enters the body, the immune system produces antibodies, also known as B cells and T cells, that fight these bacteria and record information about them. If you are ever exposed to this disease again, your body will recognize it and will know how to fight it off. Vaccines are important because they keep you from contracting or spreading viral diseases you could be exposed to, and they help preserve herd immunity, which directly affects those who cannot be vaccinated due to certain health conditions, such as patients receiving chemotherapy as well as newborns due to their young age. Not having yourself or your child vaccinated puts you at risk of contracting viral diseases or developing chronic illnesses that could have otherwise been prevented through immunization.
Every year, vaccines save between 2 to 3 million lives worldwide. While vaccination rates are still high in Western countries, some groups are declining recommended vaccines for their children, often due to non-medical reasons. These groups are commonly referred to as anti-vaxxers, and they pose a public health threat to themselves and others.
The problem with anti-vaccination is that those who do not receive vaccinations are more predisposed towards diseases, especially younger children that are threatened by more minor diseases. There are those who believe vaccinations are harmful, but this false belief can be counterproductive, as it can increase the prevalence or even morbidity of those diseases. Also, children who are not vaccinated in childhood or after birth are at the risk of health problems and even death. As shown in the figure, an example of this is that about 11% of the children in the study who are not vaccinated had allergies, 9% had sleep problems, 3% had growth pain, and 7% had a type of middle ear infection. Vaccinations are available at clinics, local events, and even pharmacies and the like. It is best to prevent those diseases and seek treatment if already contracted. More information regarding vaccination and the benefits are available online in a widespread manner, and those in the medical field or hospital officials will be able to elaborate on the benefits of vaccination and the process. Even the immunization requirement for UCSD provides information on vaccination in addition to requiring it.
The World Health Organization provides the public with a variety of informational articles concerning the common misconceptions about immunization. These articles explain the fraudulent claims concerning vaccines, most popularly the largely believed findings by ex-physician Andrew Wakefield and his supposed link between vaccines and autism. In order to intervene with anti-vaxxers, there are certain state-regulated vaccinations for all children attending schools. However, not every state in the U.S. requires a child to be vaccinated. For example, one could avoid state-regulated vaccines if it conflicts with their personal or religious beliefs or for some type of medical reason. In 2016, California changed their vaccine regulations to make vaccines mandatory for children, regardless of personal or religious beliefs, the only exemption being medical reasons. The road to receive a vaccine is fairly easy and accessible regardless of socioeconomic status. Vaccines are available at your doctor's office, local pharmacies such as CVS, Walgreens, Rite Aid, health centers, and travel clinics. The National Health Information Coalition is an independent organization that works with the CDC and other agencies to promote public health and prevent diseases. To intervene with the anti-vaxxers, every August, NPHIC hosts National Immunization Awareness Month to emphasize the importance of vaccines in every community.
In a long-term cohort study from the late 1980s, researchers found that children with vaccine exemptions were 35 times more likely to contract measles as their non-exempt peers. In a similar but more recent study done in Colorado, researchers saw exempt children as 22 times as likely to have had measles and 6 times as likely to have had whooping cough. From 2000 to 2016, 1,416 measles cases were reported in published summaries or outbreak reports, and more than half of these cases had no histories of a measles vaccination. Of these unvaccinated cases, about 70% had a non-medical exemption. Several misconceptions have led to the rise in non-medical exemptions, including the false claims that the MMR vaccine causes autism and that there are harmful chemicals like mercury and formaldehyde in vaccines. In reality, mercury has not been in childhood vaccines since the early 2000s. Vaccines are one of the most successful public health interventions from the last century. They are cost-effective with insurance, both private and funded through the government. So please, remember to get vaccinated.